we have started to reopen small shops and also to provide people with the opportunity to get out and have their physical activities. Nevertheless, we have tried to encourage people to keep on with physical distancing and to avoid gathering during the weekend so that we can really control the infection. In addition, people were also encouraged to wear masks when they enter a shop so that the spread of asymptomatic carriers which can transmit the infection is slightly reduced.
Do you think the rate at which some of these restrictions are being lifted is appropriate? Because Austria has taken a very different approach, for example, to the UK or to France, where much stricter measures are still in place for a few weeks to come.
In Austria, there was a very early and very harsh intervention of the government, which really shut down the whole public system, including the tourism, which is the major source of income, for example, in the Western countries. And this was very strict and people got used to it. But nevertheless, due to the fact that it was quite early, we probably had a reduction in the new cases after 2 or 3 weeks. And now we see a constant decrease in new cases and also a constant decrease in the number of patients hospitalized either at normal wards or at the ICU. So currently we have less than 100 new cases per day, which is as low as ever.
What is the country doing in terms of testing? How's it monitoring the outbreak, and how do you think that should continue?
The strategy is still to detect cases very early and to encourage people to seek medical attention if they have any symptoms which are compatible with COVID. And the second thing is that we perform very vigorous contact tracing along with quarantine. In addition, the country has started also to check, for example, employees in nursing homes or in critical environment and in hospitals for asymptomatic or low symptomatic infections. So to really identify those people very early and to avoid that the infection spreads to the most vulnerable people, for example, the elderly in different settings.